You might not recognize it at first. It starts quietly. A drink every night to unwind, a pill to help with sleep, smoking to calm nerves, missing work occasionally, getting irritable for no clear reason, pulling away from family conversations. And then one day, you find yourself wondering, is something wrong? Am I overreacting? Why can't they just stop? If these thoughts have crossed your mind, this video is meant for you. Hi, I'm Dr. Jyotsna Vanka, a psychiatrist at Arunya Mental Health, and I closely work with individuals and families facing substance-related problems. Every week, I meet parents, partners, and siblings who feel worried, confused, and emotionally drained. They often tell me that they don't recognize the person they love anymore. Today, I want to explain clearly and scientifically what commonly misused substances do to the brain and body, what the warning signs families usually notice are, and why early de-addiction treatment combined with real personal effort can completely change the direction of someone's life. Most addictive substances interfere with the brain's reward and stress systems, particularly chemicals like dopamine. With repeated use, the brain slowly recalibrates. Pleasure from everyday life drops, cravings become stronger, and irritability or restlessness appear when the substance is not available. Judgment weakens, emotions become harder to regulate, and the substance slowly turns into a way of sleeping, coping with stress, or escaping uncomfortable feelings. These are not simple personality flaws. They reflect genuine biological changes inside the brain. At the same time, recovery does not happen automatically. The brain improves only when a person actively participates in treatment, showing up for appointments, tolerating discomfort, changing routines, and practicing new coping skills day after day. Alcohol problems often develop so gradually that families miss the early signals. You may notice drinking happening in secret, arguments becoming more frequent, mornings starting with shaking hands, memory gaps after evenings out, or responsibilities being neglected. Over months or years, mood often shifts. Depression and anxiety become common. Sleep is disturbed, thinking slows. In severe cases, people may grow suspicious, confused, or even hear voices. Physically, alcohol can injure the liver, pancreas, heart, stomach, and nerves. Stopping suddenly can sometimes be dangerous and may even provoke seizures or confusion, which is why withdrawal should never be taken lightly and often requires medical supervision. With tobacco or vaping, families often notice constant urges to smoke, restlessness when cigarettes aren't available, breathlessness while climbing stairs, a chronic cough, and increasing medical bills. Over time, nicotine addiction drives heart disease, strokes, lung disorders, cancers, sexual dysfunctioning, and worsening anxiety. Quitting usually involves repeated serious attempts, careful planning, and sometimes medication. Persistence matters far more than waiting for motivation. Cannabis use may show up as withdrawal from social life, failing grades or work performance, forgetfulness, poor drive, or growing irritability. Some people experience panic attacks or intense paranoia. In young or vulnerable individuals, cannabis can trigger psychotic symptoms that persist even after stopping. Recovery here often involves understanding what the substance is being used for. Sleep problems, emotional distress, boredom, and deliberately learning healthier ways to cope. Prescription medicines deserve special mention because families often assume that if something comes from a doctor, it cannot cause harm. With sleeping pills or anti-anxiety drugs, warning signs include steadily increasing doses, visiting multiple clinics for refills, emotional flattening, confusion, and accidents or falls. Abruptly stopping these medications can provoke severe withdrawal, so tapering must be planned carefully. With opioid painkillers, families may see extreme drowsiness, pinpoint pupils, constipation, mood swings, neglect of hygiene, or frightening overdose episodes. These drugs slow breathing and can become fatal, particularly when mixed with alcohol or other sedatives. Stimulants and party drugs create a different pattern. Families often describe bursts of excessive energy followed by deep crashes, sleeplessness lasting days, rapid weight loss, aggression, and growing suspiciousness. Some people begin talking to themselves and responding to voices that aren't there. Over time, these substances can precipitate heart attacks, strokes, dental destruction, skin infections, and long-lasting psychiatric illnesses. Across all substances, there are certain red flags that should not be ignored. Use that keeps increasing, repeated failed attempts to quit, denial despite consequences, lying or secrecy, financial problems, legal trouble, medical emergencies, or any talk of self-harm are strong signals that professional help is urgently needed. Waiting rarely makes things easier. De-addiction treatment is not about punishment or simply locking someone away. It is a structured medical and psychological care. It may involve supervised detoxification, treatment of withdrawal, management of depression, anxiety, or psychosis, and therapies that target habits and thinking patterns, medications that reduce cravings, family counseling, relapse prevention planning, and long-term follow-ups. And crucially, it requires the person's effort. Recovery depends on attending sessions, taking medications as prescribed, avoiding high-risk environments, rebuilding daily routines, and staying engaged even when motivation fluctuates. Families have an essential role too, supporting recovery without enabling substance use, encouraging consistency, and setting healthy boundaries. If someone you love is struggling, remember this: you are not expected to manage this alone. With timely treatment, genuine effort, and the right professional guidance, people do recover. Brains heal, relationships stabilize, and lives become predictable again. If you're uncertain about what you're seeing or whether it's time to intervene, speaking to a mental health professional can offer clarity and direction. Sometimes one early conversation makes all the difference.